Hi, I'm Dr. Mackay, and today we are going to go over how to roll over in bed with severe lower back pain or sciatica. The key to rolling over in bed with severe lower back pain, herniated discs, or sciatica is to first know what we don't want to do. So with the lumbar spine, at all times we want to maintain a proper lower back lumbar curvature. That helps to take stress off those nerves. We also really want to minimize how much twisting and rotation we are putting into our spine. So again, we want to minimize how much forward bending we are doing with our spine. And then we really want to avoid excessive twisting or turning with our lower back, which can really irritate those discs and those nerves. The key to rolling over or really moving in bed with severe lower back pain or sciatica or herniated discs is to really minimize twisting with your spine. So if we want to roll over towards my right side, I want to make sure that I have sufficient space. So I'm going to shift my spine over. I want to do that as a unit. And then to roll over, I don't want to just twist my upper body separate from my lower back because that's going to put a lot of pressure and stress onto my lower back. I want to roll as a log in one unit so that my upper body, my torso is really fixed to my hips and pelvis. So my top arm helps, it kind of comes over, and then my whole body rotates at the same time. That's the key. I don't want to be just twisting just the top part. I want to be rolling as a unit all at one time. That really minimizes the stress on the lower back discs and nerves. Any questions about that, please ask.